Good day, everyone. I think it's 12, so we can start. Thank you and welcome of today's WHO and TB webinar, WHO Multisectoral Accountability Framework for TB, Progress, Experiences and Challenges in Adaptation and Implementation. I would hand over to Dr. Teresa Kazaeva, Director of the WHO Global Tuberculosis Program. Thank you, Teresa. The floor is yours.
Thank you very much, Marta. Dear colleagues, friends, distinguished guests and partners, warm greetings from Geneva, from WHO headquarters. Happy to see you all today, despite of you being very busy. I'm sure it was a very challenging, very special year for all of us, and it's coming to an end. But we can't miss this opportunity, and we are trying to use every moment and every day for the engagement with the key partners in this situation and to share our progress in adaptation and implementation. This very important framework for the multi-sectoral engagement of all key partners and for strengthening accountability and in general aimed to accelerate further progress towards ending TB. Yes, of course, we fully understand that we are in the middle of the new pandemic, but of course it's very unusual situation. But it is not a reason for us to stop our activities, but it is the reason to double and to triple our efforts. So with this, I would like to thank you once again for your time. We can see already we have 76 participants. Number of people is growing, and we hope that it will be important and a fruitful discussion. We're expecting your questions. We will be happy to respond to these questions. We have excellent round of panelists, speakers. So with this, I will stop and will give a floor for the opening remarks to the Assistant Director General of the WHO for the division of the Universal Health Coverage, Communicable and Non-Communicable Diseases, Dr. René Mingui. Please, floor is yours. Thank you very much.
Okay, thank you, Teresa. Dear colleagues and friends, good morning, good afternoon, and good evening. It's my great honor and pleasure to join you all as the WHO webinar on the multi-sectoral accountability framework for tuberculosis. As heard from Teresa, this has been difficult and unprecedented year for the world given the COVID-19 pandemic that has made immense impact on the global health and economies. Progress on the health-related SDGs was already lacking before COVID-19, and then COVID-19 has hampered success in many countries and further widens inequalities. Based on WHO modeling, the projections show that deaths due to tuberculosis likely increased as a result of impact COVID-19, unless remedial actions are taken to restore and expand services. The impact of COVID-19 on tuberculosis mortality and mobility will likely continue for the years to come. There is therefore the needs for WHO and partners to provide additional support and resources to the national programs to enhance their capacity to be able to mitigate the impact of this pandemic. Tuberculosis remains one of the leading causes of death from one agency's agenda for the infectious agent. Achieving global TB targets require multi-sectoral action to address the broader determinants that influence tuberculosis epidemic, such as poverty, undernutrition management, HIV, smoking, and diabetes, and to mitigate their social economic impact. WHO leads multi-sector engagement and actions as shown by commitment to the Global Action Plan for the Healthy Lives and Well-being for All. WHO has developed a global action plan following the request of member states to operationalize SDG 3. This is a joint commitment made by 12 key stakeholders, including Gavi, and Global Financial Facility and Global Fund, UNAIDS, UNDP, UNFPA, UNICEF, UNITED, UN Women, and WFP, which demonstrate a very good example of meaningful engagement of different stakeholders and partners in global level. The WHO multi-sectoral accountability framework for the tuberculosis is fully aligned with SDG 3 Global Action Plan and gives another opportunities for the multi-sectoral engagement to celebrate progress towards SDG targets to end TB by 2030. There's encouraged progress at country level, which is absolutely critical in harness the high-level government leadership and the multi-sectoral engagement to end TB, and we'll hear more examples from the country at this webinar. Whether in the government's national TB programs, national or regional organizations, civil society, and academy, this past year has seen great engagement in the discussion to advance the work and support effectively accountabilities of governments and all stakeholders and multi-sectoral collaboration at global, regional, and national levels in order to accelerate progress to end tuberculosis epidemic. As requested by the member states and 2020 United Nations Secretary General report on implementation progress of the political declaration of UNHM on ending TB, WHO will continue to provide the global leadership and the coordination for the multi-sectoral accountability framework for TB and support its implementation at the country and regional and global levels. So let me thank all the panelists and also for all the participants for your support and commitment to end TB. With this remarks, I wish you all fruitful deliberation during this webinar and Happy New Year in 2021. Thank you.
Thank you very much, Dr. Ren, for your words and your support, constant support. And thank you, Dr. Kaseva, for your welcoming remarks. Let me present myself. I'm Marta Calvi, Technical Officer of the Global TB Program. And let me give you a couple of housekeeping notes. First of all, we are live on YouTube, live stream on YouTube. And also recorded version of this webinar will be available on our website after the webinar. We would like to receive your questions in the Q&A chat of this webinar. So you can find the icon of Q&A at the bottom of your Zoom page. Please do share your questions while we proceed in the webinar, and we will be ready to answer them. The webinar will run as follows. We are going to hear Dr. Teresa's presentation on the WHO Multisectoral Accountability Framework 20B, Global Coordination and Progress. That will be followed by a panel discussion on Framework for Impact, using the WHO Maf-Tb to save and improve lives of people affected by TB in countries and regions. As I mentioned, after the panel discussion, we will have the time for a Q&A session, for which I invite you again to write your question in the chat. Before closing, we will launch a Maf-Tb forum page. So this is another reason to stay with us until then. Without any further hesitation, I would now give the floor to Dr. Teresa Kaseva for her presentation. Dr. Teresa, the floor is yours.
Yes, thank you very much, Marta. Just one quick clarification. Probably in Q&A box will be better to put the questions, then it will be easier then to capture them and to respond. So I see it's a really impressive number is growing from minute to minute, and why it's important also for us, because it's not about the guidelines, it's not about our traditional topics. Multi-sector accountability framework is relatively new tool and new vision, and we see this growing interest, and it means a lot for us. It means that audience, our TB community and broader understand the importance of this approach, especially in nowadays. So I will share my screen. Okay. Can you see? Okay, trying to put in the slideshow mode. Please let me know.
Try slideshow and then
Animation.
and no, slideshow, yes, and then from beginning.
Okay, yes, yes, I see now. So I hope you can see it now.
Teresa, can you click display settings and say duplicate, please, so that it's clearer?
Okay. So is it better now?
Yes.
Okay, good, good. Let's start. So it will be a little bit long presentation, but it's done for purpose. First of all, a lot of work has been done, and we would like to share this work with you. Another reason is to attract your attention to some important elements of the MAF, to the MAF vision and to the concept. And again, it's done because of this is new tool first. Second reason is because we can see some tendencies sometimes in misinterpretation and not quite clear understanding what MAF is it and how it could be better used. So that's why it will be sorry for being, if it will be a little bit long. Now let's start from our famous circus of sustainable development goals. We have 17 sustainable development goals, and you can see that this vision, that sustainable development goal 3, focusing on good health and well-being for all, is in the middle. And this is vision of our senior leadership of Director General Dr. Tedros, and he is working himself tireless to promote this vision that indeed, and the current situations demonstrate that TB is in the middle of all sustainable development goals, and neither progress, nothing good and ambitious will happen if people and their health will not be secured, protected, and if there will not be equal access to all people to the quality health services. And in the same time, this is essential condition for driving SDG agenda as a whole. And that's why with this vision, we are trying as organization to engage, first of all, member states, their leaders, and to support this prioritization of the health agenda, even in the political agenda. And here you can see that this is fully aligned with our WHO ambitious priorities, 3 billion targets. These are targets for 5 years. And I will remind you, 1 billion more people provided with health coverage, 1 billion more people's life made safer, and 1 billion more people's lives improved. And of course, we are facing very unprecedented situation, but it's not at all the reason to give up. And we are continuing together with our partners, with the civil society, with the communities to push this agenda. Here you can see also a global action plan for healthy lives and well-being for all. It is clear example of the document of the vision, how operationalize SDG 3, and it was requested by the member states, clear request to develop this operational guidance for the member states, how different SDGs, different sectors should be involved and meaningfully contribute into the health agenda. As Dr. Ren told, multi-sectoral accountability framework is also fully aligned with this. This is a well-known slide, but once again, it's quite clearly explain our role and place as a place of the TB problem and the problem of people suffering from TB in this health agenda. This is a famous pathway of people from the moment of exposure with Mycobacterial tuberculosis, you see the scenarios could be different. Unfortunately, there could be a negative scenario. People are still dying, and you can see that TB remains one of the biggest infectious disease killers with 1.4 million deaths. But there could be, of course, and should be more positive, a pathway with people becoming cured and not facing any financial hardships, neither them nor their families. And this is a scenario we are aimed to provide to all people with a TB. And it's possible because TB is a curable and treatable disease. And here you can see how different SDGs and different factors beyond health agenda can influence on this pathway, on this disease. And you can see that around at least 11 SDGs are heavily contributing into this process. And our opportunities as a health sector are very limited. Most frequently, we can see patients when it's coming to the facilities or in the better situation where we're actively looking for the people infected or falling ill with TB, and at the stage of being infected or sick, and then we're providing treatment. But the process of exposure can be long, and then suffering and in the absence of treatment, it's also can be long. And that's why we should clearly know what are the our focused activities should be to provide, to minimize this unfortunate pathway of hardships and problems, and to shorten the process of treatment, and to make less people falling ill with tuberculosis. So now about the subject of our today's webinar, WHO multisectoral framework itself. I would like to remind you that for the first time, this idea of the development special vision and tool for TB appeared during Moscow Ministerial Conference in 2017, and for the first time it was fixed in the Moscow Declaration. So with the specific request to WHO to develop a multi-sectoral accountability framework. So later on it was highlighted and again confirmed during the first ever high-level meeting on TB in 2018. And you can see we've received special request, Director General of the WHO to develop multi-sectoral accountability framework and ensure its timely implementation. Another request to WHO was related to the coordination of efforts of all the stakeholders and preparation of the progress report, and later on progress report which happened this year, and a comprehensive review in 2023. So we are following this way, sorry, just I'm moving a little bit faster. Okay, we'll go back. So something wrong is happening with my presentation. Sorry. Yes. Oh my God. Very sensitive. Probably now it will work. I would like to remind you that multi-sectoral accountability framework was developed with the vision to accelerate progress towards ending TB, to strengthen engagement of different sectors and partners, and to provide better accountability. And accountability means meaningful engagement and meaningful contribution into the activities of different stakeholders. And here you can see 4 essential elements of the multi-sectoral accountability framework: commitments, actions, monitoring and reporting, and review. So why I would like once again to focus your attention, because I can see tendencies that sometimes we are missing the vision and understanding that all 4 elements should be in place. Only with strengthening accountability in the absence of clear commitments, global commitments translated into the national commitments with clear targets, approved by actions, and which are provided by necessary financing, with regular monitoring, reporting, and review, accountability itself in principle cannot be possible. We will not achieve the result which we were aimed. And that's why I would like once again to highlight that all 4 elements should be in place. And this is the essential condition. All the stakeholders involved in these actions should have clear roles and responsibility, and should be all accountable. When we're talking about accountability, it doesn't mean that only head of states or senior officials should be accountable. Everyone, and we as WHO are also following this principle, and we're trying and we're providing accountability for all our actions and for all our commitments. Oh my God, so it moved really very fast. So I don't know why it's going like this. I'm trying to bring it back. So anyway, you know very well these elements, and multi-sectoral accountability framework has two parts. We have global and national multi-sectoral accountability framework. So still I will try to bring it back because it's important to demonstrate these 2 elements. So this is national multi-sectoral accountability framework. As I mentioned, we have national and global, and these are closely connected essential parts of but they have also some differences. And we must understand that at global level, we will not be able effective and meaningful coordination of the multi-sector actions if there will not be in place in the country this mechanism. And that's why our focus for the first should be at the national development and adaptation of the national accountability mechanism. You can see again this cycle with some specification over and details on these elements, and elements in red and in examples in red are either not existing in many countries, that is the reason why they're in red, or under the development. But in many countries, we can see that already now everything is already in place. But being in place and function well is not necessarily the same thing. And so this cycle with these very important and meaningful elements should be in place as an essential condition of our progress and work. Now, if we are looking at the global, and regional elements, of course, there you can see high level of activities and actions like Maf-Tb strategy, sustainable development goals and their targets. Sustainable development goals and their targets, and our regular monitoring and reporting with the global TB report, our review mechanism, which you will see later on, also in place with the regular review by the World Health Assembly, by the United Nations General Assembly, and this latest report, progress report by UN Secretary General, demonstrated this example. Essential elements are in place. We have commitments, We have strategies, we have plans, and we have mechanisms for the global monitoring and review. But of course, all of them should be strengthened, and especially engagement of other relevant stakeholders and sectors, UN agencies, partners, and civil society. So now let's look what is happening, where we are with the progress. And as it was requested, WHO is continuing providing coordination and support in MAF implementation. So we are promoting collaboration between stakeholders, parliamentarians, other UN agencies, and of course we're trying to include civil society involved in all our key activities. So in terms of additional tools we've developed, one clear example is for sure a baseline assessment checklist, which include annexes, important annexes with the details for the engagement of other sectors of economics, other ministries, for the engagement of civil society, and for the adaptation and implementation of essential WHO guidelines and tools. So I've talked already about our regular monitoring, reporting, reviewing, and of course, all relevant requested technical support for to the country is provided. Here you can see our checklist, baseline checklist, and we're happy that many countries and partners are very actively using this checklist. And later on, I will demonstrate progress on some essential elements. And once again, the purpose of this checklist is not for the collecting just information what is happening in the countries, but it's more for the to support countries, to guide them how this should happen at the country level, because establishment of high-level review commissions, for example, or some groups for the monitoring of the progress will not give us opportunity to say that MAF is established and functioning. If at least 70 to 80% of listed essential elements like engagement of key ministers of social protection, justice, finances, with the clear indicators and financing of the activities will not be provided, we cannot say that only with the creation some high-level review commissions or making some statements by the member states, by the heads of states, we can consider that it works and functions effectively as it was planned. So that's why I would once again attract your attention and request to use it more actively for the practical purposes. It's one of the examples. So now when we're talking about high-level activities, and again, with the intention, be accountable for all our work, to receive your feedback, to receive your comments, what could be done better. We would like to present some key activities for your attention. So before lockdowns happened, we've organized 12 high-level missions with the intention to encourage, to guide countries and high-level officials how commitments should be put into the reasonable actions. We have Director General flagship initiative, Find Treat All to NTB, with our partners, Top-TB Partnership, Global Fund, with engagement of civil society, again to push to move forward this agenda. We've developed so-called package of tools, accelerate tools and guidance, which can accelerate progress and support to guide in the core activities. We've developed and adopted global strategy for TB research and innovation. We've launched multi-stakeholder, multi-agency platform with engagement of all key partners. We're working closely with them, and also we've engaged WHO Civil Society Task Force, which is working hand in hand with us in all these activities, and we're very proud about this meaningful engagement. And youth initiative is another example of engagement, some potentially important partners. So will not go into much details, but it clearly shows that at the global level, all this coordination and engagement is moving forward. So global TB report is an example, as I told, of the monitoring, regular monitoring and review of the progress. And we're happy that even during this COVID crisis, more than 200 countries were able to report and provide very important data. And now we are collecting even monthly data on notification of TB cases. Moving forward, we have app version, and we are analyzing, you can see, social determinants for each of the high TB burden countries, which is also clear contribution in the promoting of this multi-sectoral engagement. And you can see clear roles of different social determinant for different countries. For example, in India, we can see that the key driver is definitely undernutrition. In other countries, like in Kazakhstan, we can see that the prevalence of other determinants as alcohol use, the tobacco smoking, and this gives us real arguments, real opportunity to share reasonable requests with other ministries and sectors. This slide again shows what are the key drivers, social determinants. Sometimes they are beyond health sector. Alcohol use disorders, there are close linkages with other sectors of economics, undernourishment, smoking, and you can see the growing role of factor globally, risk factor of undernourishment, and it's clear that without addressing it urgently, and for this we can again use this vision of the multi-sector accountability framework, we will not be able to successfully continue our fight against TB. So now, National Patient Cost Surveys are also directly contributing in promoting of the importance of the engagement of different sectors. You can see that range of people facing catastrophic costs, and in all the surveys we can see more or less the same situation. This level of catastrophic costs and hardships is enormous, and especially for people with drug-resistant TB. And this should be used for clear messaging to those responsible for the financial investments in some specific activities. And that's why we should actively use this information which we're sharing. Global review of the progress, example of high-level review, and it was done. A report was launched recently and has very clear messages. Of course, overview of the progress and gaps. We've highlighted information on the COVID pandemic and TB impact and implications, and of course, one of the key part is urgent recommendations to the countries. And number one recommendation is coming, urgent request, fully activate high-level leadership to urgently reduce TB death and drive multi-sectoral action to end TB. And this is probably for the first time when we are showing and putting together importance of the multi-sectoral action for the reducing of TB death. We're highlighting growing role of social determinants, poverty, undernutrition, and other risk factors, and asking for the urgent actions. It means that investments should be done not only into the health sector, but beyond, but for the purposes which can contribute and into the fight against TB. First of all, can help people. And this request for the high-level multi-sectoral collaboration is clear, and it's coming first out of 10 priority recommendations of the UNSG report. We can see progress not only, of course, at global level, but first of all, and it's probably the most important progress at regional and country level. And you can see examples, very positive and important progress from all the region. We can see establishment of high-level reviews by the African Union in collaboration with the WHO regional office, other partners, based on annual continental scorecards for TB. We can see in the European region creation of the UN common position on multiple diseases under the high-level leadership. And we must say that European region also demonstrate very good examples of engagement of civil society. We can see organization of ministerial meeting in the Southeast Asian region, and with follow-up actions and meetings. We can see the sub-regional mechanism to support UN global targets in the America. We have a special Council of Ministers of Health of Central America and Dominican Republic as another example. We can see the advanced discussion on TB elimination strategies by Gulf Coordination Council. And in the Western Pacific region, we can see numerous races to end TB. So these are all clear examples of taking actions and to put in place this real multi-sectoral mechanism of collaboration. National progress, of course, is also driven by actions related to MAF adaptation and implementation. We can see precedent initiatives in India, Indonesia, Pakistan, Philippines, Vietnam's races to end TB. In 2020, 86 countries reported that the national multi-sectoral accountability mechanism and the high-level leadership was created, was in place, of which 62 included a representative of civil society and TB-affected communities. Now, about reporting in the country, we can see that 133 countries reported that they have official and annual report about TB epidemic and progress. It's not about the reporting to WHO, it's their national reports. At the 30 high TB burden countries, they have national strategic plans, but the request was to update, not all of them updated, with taking into consideration that this MAF approach should be also embedded in the national strategic plan. And here is a summary of this progress in adaptation of some essential important elements in 30 high TB burden countries. I will not go into the details, you will see them, but you can see that the number of countries reported on these essential elements are more than 200, 30, including 30 high TB burden countries, but situation is quite different. And for the only in 69% of cases we can see national strategic plans. Civil society engagement is provided a total only in 54%. The update of NSPs with this new modern vision happened only in 45%. So, and reports are also available, still not in every country. Much more should be done. High-level review mechanisms, which are also very important, but not the only one element which should be in place. We can see progress, and progress is also different. Only 40% of the countries established, 29% engaged civil society representatives, and some clear recommendations were provided only in 14% of the cases. And I would like to attract your attention on this. Thing is not to create a mechanism. It's important also to provide its effective functioning. And this difference in the results and compare with the numbers of created mechanisms shows that, again, we should pay attention at this and to avoid just formal existence of this mechanism without their meaningful contribution into the progress. So COVID-19 and its impact, I will not repeat, it's well known and the impact is really huge. And we are predicting, unfortunately, further growth in TB death and trying to do altogether our best to avoid this further growth. And again, this is the request to all of us to work beyond TB for TB. I mean, to protect people with tuberculosis and to protect our progress. But current situation shows that this drop in TB notification is continuing. It's from our report, and here you can see information about the disruption of the essential services. And it's clear that disease-specific programs are affected, but in the same time, we can see how heavily TB programs are contributing into the COVID response, and especially in high TB burden countries, and doing it quite effectively. But now our request should be, yes, we are able, our community networks are developed, and we are able to provide response not only to TB, but also to COVID, which is also example of multi-sector collaboration. But now we should protect and TB programs from disruption, and to avoid allocation of funding and machines. And this is also very important information for the discussion on all levels, global, national, and regional level. And here you can see some tools and guidance provided by WHO from the very beginning of the epidemic. The importance of taking into consideration severe economic impact and for further exacerbation of the situation by COVID-19 also should be clear for all of us. And further, unfortunately, TB epidemic will be driven by these determinants, as I told, drops in GDP, as we can see from the history, very fast reflects on TB situation, and undernutrition is one of the key drivers of the epidemic. And without, again, engagement of other sectors, it will not be possible to solve within TB programs, only by finding people and providing them treatment. So here you can see also in different publications how important is to address COVID-19 related issues and other issues beyond. So now looking ahead, of course, we would like to reaffirm you that we will continue lead these efforts to advance multi-sectoral actions and support countries in all the according to their requests and activities. Civil society will provide meaningful and continued engagement in all our activities and all the, as well as all other partners. So we will try to advocate for the mobilization of multi-sectoral resources, and our approaches for the advocacy should be also become more strong, more demanding. So, and with this, I will probably come to an end. Sorry for some technical issues during my presentation. For those who will be interested, we can share it and other details. So I will stop and will now give floor to my colleagues for further discussion about situation in the regions and country. Thank you very much.
Thank you, Teresa. Thank you for your exhaustive and rich presentation to bring us once back on the same page on the WHO multi-sectoral accountability framework. As you said, there has been encouraging progress in countries and region as well as global level. And we are going to hear meaningful examples of this progress in the panel session. Our panelists will be 7, and they will bring perspectives from country, regions, civil society, research networks, and WHO on framework for impact, using the WHO multi-sectoral accountability framework for TB to save and improve lives of people affected by TB. I'm inviting now the first panelist, who's joining us from Uganda, Dr. Patrick Tusime, the Commissioner Disease Control at Ministry of Health. If you can turn on your video. Uganda developed a multi-sectoral accountability framework in 2020 and established a high-level mechanism. So, Dr. Tusime, we would like to hear what was the process and the key steps in bringing the TB issues in the high-level political agenda, and what were the enabling factors leading to the establishment of such a framework. Dr. Tusime, the floor is yours. Thank you. Dr. Tusime, I see you are here. If you can unmute your, hello.
Hello, colleagues, good afternoon.
We can hear you.
Yeah, sorry, my connection seems to be poor here.
We can hear you and see you.
Thank you, thank you. I'm Patrick Tusime from Uganda. I'm representing the Permanent Secretary, Ministry of Health. I'm the Commissioner for Communicable Diseases Prevention and Control. And I'm going to share with you Uganda's experience. And in this, I'm going to cover briefly the process and the key steps we've taken in bringing TB issues in the high-level political agenda, the enabling factors leading up to the establishment of this framework and the coordination mechanism, and the main functions of this mechanism. And lastly, I'll share with you the expected outcomes in terms of impact. The screen is being shared, but it seems we are moving at different pace. So on the process we have gone through to bring TB on the high-level political agenda, the background to this is that the Director General of the World Health Organization in the year 2019 wrote to the President of Uganda requesting for high-level, for establishment of a national multi-sectoral accountability mechanism for TB. Following that, the country initiated stakeholder consultations in the same year to inform the national strategic plan and the actions for multi-sector engagement. Then the Permanent Secretary of the Ministry of Health requested the Office of the Prime Minister to lead the engagement process for the multi-sectoral accountability framework for TB. And then the Office of the Prime Minister was targeted because It is the leader of government business in parliament. It is responsible for coordination and implementation of government policies across ministries, departments, and other public institutions and agencies. And then the Right Honorable Prime Minister is the one who led the delegation, the Ugandan delegation, the UN high-level meeting in 2018. So we felt that the OPM was the initial target that would coordinate this mechanism. Then the Right Honorable Prime Minister issued a directive to establish this accountability framework, and implementation of the directive was done by the Prime Minister's delivery unit. Then the permanent secretary of the Ministry of Health was appointed the technical lead of the implementation, coordination, and steering committee of the accountability framework for TB. In doing this, we've had some enabling factors that made it possible for us in Uganda to proceed and have this type of advocacy at high level. One of them was the global drive to strengthen multi-sectoral collaboration for ending TB. This was fertile ground for us on which we built. Two, the Right Honorable Prime Minister of Uganda was the head of delegation to the UN high-level meeting, and he acknowledged the need to end TB by the year 2030. Commitment towards TB epidemic control by the Minister of Health top management was another enabling factor. Then also the epidemic control for TB was well enshrined in the third National Development Plan. We also built on a previous experience of the multi-sector accountability framework approach for HIV. We also had variable technical support from the World Health Organization here in Uganda. And the timing coincided with the development of the new National Strategic Plan for TB, which covers the period 2020-21, 2024-25. Furthermore, the timing coincided with the development of the Ministry of Health plans and budgets. So it was easier to integrate this in the planning process. And also the ministries, departments, and agencies had been extensively consulted in the development of the National TB and Leprosy Strategic Plan. And lastly, but not least, the ending NSP had already initiated several high-level advocacy efforts, including the work of the TB Parliamentary Caucus and the Advocacy, Communication, and Social Mobilization Technical Working Group. Now, the main functions of this high-level mechanism include convening the monitoring and accountability events, track progress in achieving set targets, mobilize the required resources, mobilize and sensitize all leaders on tuberculosis problem, ensure prioritization of TB involvement programs, and hold biannual review meetings. And out of these, the expected outcomes include more than 90% awareness about the TB problem in Uganda, and raising by more than 90% TB preventive treatment coverage among the eligible people, and raising by 90% TB treatment coverage among all people who fall ill with the disease, and also achieving, we expect to achieve more than 90% of TB treatment success among those diagnosed with TB disease. And finally, we expect to reduce by 20% the catastrophic costs due to TB from the current 53% by the end of the year 2025. Thank you.
Thank you very much for your contribution, Dr. Tusime. We'd like now to move to another country experience. So I invite Dr. Imbudi, the Indonesian National Program Manager, to join us. Indonesia welcomed the presidential initiative in January 2020, when the president held an event with officials from across the country to launch a TB elimination movement. Since then, Indonesia has moved forward in advancing the multi-sectoral accountability framework in the country. So we would like to hear, Dr. Pambudi, what structure and resources have been put in place for the WHO Maf to be effective in its operational activities and to be sustainable? And how did the country manage to successfully advance the process in such a time of pandemic and elevate the discussion on TB to the highest political level? Dr. Pambudi, the floor is yours.
Yeah, thank you, Marcia. So good evening from Indonesia to all of you that attending for the talk today. And I'm grateful that despite the COVID-19 pandemics, we can still talk virtually. So allow me to share my screen. Okay. Yeah, so ladies and gentlemen, so nowadays it's more important than ever for us to strengthen and learn from one another to accelerate our efforts in ending tuberculosis. Especially on how multi-sector accountability framework deliver in Indonesia towards TB eliminations. Like Dr. Teresa mentioned about how we can make like a framework from the actions, monitored and reporting, and also how to review this framework works or not. So this is the picture from our president, Mr. Jokowi, when he launched movement to TB elimination in Indonesia on January 2020. So one of the principles to improve our health systems for those who needs it the most and effectively is accountability. However, accountability is not as simple about answerability and sanctions for sake of compliance of transparency. Accountability anchors in purpose. So in Indonesia, our purpose is to improve patient-centered TB services, delivery and management through feedback and learning between government and its partners. Our effort to provide the best possible care for people affected by TB requires political commitment, sustainable, adequate domestic financing, and also multi-sectoral actions. It is also no small feat to converge public and private interests, but it's also possible to leverage existing capacities and linkages among various actors toward achieving our purpose. This was evident when we constructed our National Strategic Plan for TB 2020-2024, involving consultations of over 200 individuals participants and also their feedback from over 100 people. And this process was conducted in January until March 2020. Ladies and gentlemen and participants, so during this pandemic, the close working relationships of government, civil societies, and communities for TB, which are grounded in accountability, have yielded synergistic outcomes in 2020. At least, I identify there are two outcomes. First is a high-level political commitment. The President of the Republic of Indonesia declared a serious commitment to eliminate TB and followed by the presidential decree on tuberculosis draft creation. And also, there is a threefold increase on the TB budget in 2021. And I'm glad to inform you here that we have analyzed the draft and we already sent it to presidential office. Hope the president will sign it soon before January 2021. And our multi-sectoral approach were reflected from the support of the other ministries to prioritize TB in their programs. As from, for example, Ministry of Social Affairs, through the Family Hope Program, a program that providing conditional social assistance and conditional cash transfers to underprivileged families as beneficiaries. Formerly, the program populations targeted only on pregnant women, children, elderly, and also disabled. But we succeed to advocate to include TB patients as its beneficiaries to receive the benefit of this program as part of our commitment to ensure the socio-economic security for the impacted TB patients. And also in some districts, TB National Program collaborate with the Ministry of Public Works and Public Housing to provide better housing for TB patients, particularly those who live in the slum area. This is to ensure that they live in the house with the better ventilation and environment as part of our commitment to fulfill the rights of patients to have proper environment to live. And also the commitment to ensure our proper TB service were reflected by the close coordination with the Ministry of Home Affairs to include the TB service indicators as a minimum health standard that need to be completed by all districts. And we also resetting and decentralize our target as part of the accountability to ensure that it adapted with the COVID situation until now. And also the last collaboration is about the, since undernutrition is the biggest contributing factors on TB in Indonesia, we integrate TB elimination program with the stunting under coordination of Vice President's Office. And in the presidential decree, it is clearly stated about who will be responsible in what activities and what indicators should be monitored to maintain the multi-sector approach. It is also clearly stated about the importance of community involvement in the framework. And the second, we are also proud to have community-led monitoring in Indonesia, so that our purpose is to improve patient-centered TB service delivery and management through the feedback and learning between government and its partners. Our effort to provide the best possible care for people affected by TB requires political commitment, sustainable, adequate domestic financing, and also multi-sectoral actions. We developed a patient-centered approach that will ensure that all TB patients will get proper TB services through one of the platform we call it CBMF, Community-Based Monitoring Framework, that works as a feedback and learning monitoring platform that will connect between patients, community, and health facilities. And also now we develop a national TB program dashboard in Android platforms like in the WHO to monitor the performance of the program from the national, provincial, district, and health centers, so in the sub-district level. And we hope that it will be launched the same time with the presidential decree as tools to monitor the multi-sectoral framework also. And throughout it all, there were times when our partners held us accountable to deliver our commitment to NTB and step up during the pandemic. We in government also ask our partners to offer ideas and solutions to solve our collective challenges in ending TB and achieve our purpose together, that in good health and well-being for all, including the researchers to bring the innovations to TB elimination. So I think it's time to ensure all of us that health services we already have were fully implemented and bring benefit for people with tuberculosis. And we should also universally ensure the availability and accessibility of the high quality services and actively address gaps and delays by engaging all sectors to end TB in Indonesia and also in the world. Thank you. I will get back to Marcia.
Thank you very much, Pak Imran, and congratulations on the announcement of further progress on the Maf-Tb work. One of the underlying principles of Maf-Tb, as we heard at WHO, Maf-Tb is the fundamental role of civil society, people and communities affected by tuberculosis, and support groups for people with tuberculosis. So we would like now to hear a perspective of a civil society representative who has given an important contribution to the Maf-related work in a number of countries in the European, as well as a civil society task force representative. So Ms. Julia Chorna, I invite you to take the floor. And the question we would like to pose you are about the role of civil society. So what role of civil society play in stimulating the discussion at country level on the multisectorial collaboration? What have been some of the key challenges to date and how have they been addressed? As well as civil society have in the multisectoral accountability framework. Julia, the floor is yours.
Thank you, Marcia. Good day, dear colleagues. It's a great pleasure and an honor for me to make an intervention at the meeting today. And answering the question which Marcia posed, I would like to say that civil society and TB-affected community organizations know how to know and strive basically to address the challenges and needs of their constituencies, key and vulnerable populations they serve. These needs, just to name a few, stretch far beyond TB disease diagnosis and treatment practicalities. So people affected by TB suffer from malnutrition, they need help with papers sometimes, housing, arranging childcare to be able to visit clinic, having their kids to continue studies while on treatment, keeping employment secured, reaching out to care when the care is remote or just unreachable, as in case when healthcare system is overwhelmed with COVID-19 response, or where, for example, some people just do not have the success as migrant workers. And these challenges which I named are very much in line with the description of social determinants Dr. Teresa and Ren addressed also in their speech, so it's all kind of aligned. And all of these needs require strong multi-sectoral response beyond health sector alone and with engagement of existing public and private infrastructure and resources. So no matter how hard civil society and community organizations try to provide psychosocial support and peer-to-peer support, various needs which I mentioned just cannot be, because they're huge and massive, they just cannot be addressed solely through civil society and community efforts and interventions. We should also don't forget that civil society largely depend on donor money, and unfortunately national budget allocations to support their work in a sustainable manner is still not being a widespread practice. So needs and gaps which could only be addressed through effective multi-sectoral collaborations serve as an entry point to stimulate country-level discussions. And civil society and community organizations are naturally entitled to stimulate these discussions and to promote strong multi-sectoral response as they speak on behalf of the vulnerable people and communities they serve. So civil society organizations, community organizations can be very effective in reaching out and bringing on board multi-sectoral stakeholders beyond health sectors alone, such as ministries of social affairs, justice, education, finance, migrations, and other related and their related agencies. And also they could bring on board for multi-sectoral discussions parliamentarians and deputies of local self-governments. One way to do it is to initiate multi-sectoral dialogue and coordination with the National TB program. And in this dialogue, position of civil society and community organizations is instrumental for keeping a priority of equity in the multi-sectoral TB response, ensuring that the needs of the most vulnerable people suffering systematic, structural, and social inequalities are prioritized in multi-sectoral TB response. So this is like first part. And if to answer your question, Marta, about role of civil society and community organization in Maf-Tb, here I should speak about practical areas of involvement in Maf-Tb implementation and operationalization at the country level. Civil society and community organizations play an important role in this operationalization, including support to launch Maf-Tb baseline assessment checklist and 3 aligned annexes we heard about from previous presentations by Dr. Teresa. There is a specific Annex 2 which was developed to measure how meaningful involvement of civil society and affected communities in TB response and multi-sectoral processes is. And I should acknowledge contribution of the Civil Society Task Force hosted by WHO Global TB Program in development of the Annex 2 and consequent support in its presentation and rollout at the regional and country levels, which basically helps to create enabling environment for its further implementation. For example, in WHO European region, members of Civil Society Task Force work closely with TB Europe Coalition, which is a regional advocacy network, and WHO Global TB Program and WHO Regional Office for Europe in presenting the Maf-Tb Annex 2 at the national dialogues and multi-stakeholder consultations in the countries of Eastern Europe and Central Asia. This is also a contribution to the broader work done by WHO Regional Office for Europe in operationalization of Maf-Tb and technical collaboration with several pilot Eastern Europe and Central Asia's countries, which started already Maf-Tb baseline assessment processes in 2020. And among such countries, I would name Belarus and Ukraine, with more countries ready to join on board from early 2021. TB Europe Coalition as a civil society network in its turn support adaptation of the Annex 2, complementing the checklist with the qualitative data collection tools and methods, such as interviews, surveys, and focus groups, and supporting civil society and community organizations in launching the Annex 2 baseline assessments in the same pilot countries under the focus of attention of WHO European Regional Office. So this example of collaboration between WHO Regional Office in Europe and TB Europe Coalition as a regional civil society is of critical importance to avoid fragmentation in data collection. Because, for example, if somebody is responsible for filling Annex 1, somebody for Annex 2, and another entity for the checklist itself, the data would be fragmented. It's very important to ensure that all is coordinated and all input is coordinated within the National TB Program for the consolidated report and recommendations. And of course, the role of civil society and community organizations in Maf-Tb baseline assessment is not expected to be limited to the collection of data within Annex 2. They should be part of baseline assessment coordination body and having a voice and contribution beyond Annex 2. So to the baseline assessment checklist itself and other annexes. And as well, it is important to remember that data collection is not the goal by itself. It's just like interim goal, because it should inform further multi-sectoral issue-based plans to address identified needs and gaps. And as such, civil society and community organizations are entitled to be drivers and parts of all four components of multi-sectoral accountability framework. Beyond that, civil society and community organizations have an important role in advocacy for establishment of strengthening of the multi-sectoral accountability operational mechanisms and high-level review mechanisms, which, for example, we already had the examples in Indonesia and Uganda. And there are no, for example, so much high-level review mechanisms so far in other countries. This is still work to be done. And needless to say that civil society should be part for both mechanisms in designing, implementing, monitoring, reviewing of the successful multi-sectoral effort in TB. And my last point is that civil society and community organizations have a role both in multi-sectoral collaboration and accountability. And in their intervention, it's very important that there is a unified and coordinated voice coming from civil society and community organization, because such a united voice make any statement stronger, and this could be reached through consensus building at the civil society and communities forums or their equivalents or mechanisms which already exist at the national levels. Thank you.
Thank you very much, Julia. Before moving forward, I would like to remind you that we'd love to hear from you. So I remind all the attendees to ask their questions in the Q&A box that you can find in the lower part of your Zoom page. So please do not hesitate to ask your questions to panelists there, so then we can answer them. Next, in our panel, we move to a regional perspective now. So we would like to hear from Dr. Tawhid Islam, coordinator of NTB and leprosy elimination in the WHO Western Pacific region. So what is your vision regarding the multi-sectoral accountability on TB at the regional level and the role of WHO? And what would you consider to be the role of regional bodies and organizations in the multi-sectoral accountability for ending TB? I see you are connected. Thank you, Tawhid, and the floor is yours.
Thank you, Mardia. Thank you very much for this opportunity. Hello to everybody. Let me share my screen. Okay, thank you. So multi-sectoral response and accountability on tuberculosis is must to end tuberculosis. What I'm gonna do, I'm gonna share some perspective from the Western Pacific region. Multi-sectoral engagement concept is not new in health, and obviously it's not new to WHO. Like we know that intersectoral response in primary health care, starting from Alma-Ata Declaration, we know that health in policy, whole of government, whole of society approach, then sustainable development goal, and obviously end TB strategy. However, our track record in doing or implementing such is not even, it is uneven. So why multi-sectoral response? That we all know. The range and complexity of the health challenges are unprecedented, especially the problem like tuberculosis. And the major gains will stem from the action outside the health sector. without fully leveraging cross-sectoral linkage, we will not be able to achieve where we want to achieve. Reducing health inequality, which is the main reason for being unreached, that will be needed broader social, economic, and cultural intervention. And we all know that with tuberculosis, and Teresa already showed it, that at least 12 SDG goals are linked. Now, we also in a COVID situation, and what's the learning from it? The learning is that multi-sectoral response is possible if there is a highest level of commitment. Now, the question is probably more on how, and that's our regional perspective, that how do we really do it? So we would like to share a few points. We believe that it needs a changing paradigm. It needs reframing. It needs partnership. It needs strategic dialogue and whispering technology towards the accountability. So what is the changing paradigm? We believe that we need to see the whole TB issue from a multi-sectoral lens. If we don't see the TB issues through that lens, we will not be able to address through the multi-sectoral pathway. So we actually see that the TB issues are multi-layered. Obviously, there is a TB specific, but there are beyond TB within health and beyond health issues. And there are overarching issues. So if we categorize the issues in that way, then the response will be automatically coming in a multi-sectoral response. Our second point is that reframing the narrative. For too long, we probably thought that what others can do for us, and we need to change it. We need to change it to that what we do for each other. That narrative is very, very important. So increasing realization and attention, TB's contribution to economic and societal development more broadly, reframing TB as a driver of growth of development. Then we are talking about the multi-sector response, which is actually partnership. And partnership requires both sides to be good partners. And we need to go beyond the silo and look for opportunities. Multi-sectoral response is obviously important for TB and also important for other NCDs, aging, antimicrobial resistance, and we need to find the synergy. Understanding that how other sectors concern and what's their language, and we need to find the common ground. Partnership with the diverse and non-traditional sectors, such as the communities, and also focusing to the young people will be needed. Now, we need to have a sustained plan. Probably we all know that this is not a short journey. And in that journey, we will be aiming for societal change. And to have that, we probably need both formal and informal approach. The formal is strategic dialogue, and it should be continuous. And informal is the whispering approach. We need to talk to as many as policymakers whenever we get chance. Now, coming to the accountability, the process and tools both are very important. Without the process, tools will not be functional. And accountability is simple. The simple means that setting expectation. So we need to define the action. We need to invite the commitment, highest level involvement with functional mechanism, measure progress with the MAF checklist and monitoring, provide feedback, reporting through various channels, community forum, parliament, and many others, and link to the consequences, which needs a continuous dialogue, and we need to evaluate regularly. So with those brief background, now we are going that how our region would like to walk the talk. So we all follow the NTB strategy, and to implement the NTB strategy, the region has a framework, and we would like to make sure that multi-sectoral accountability comes from the very highest policy level document at the regional level. So the regional framework will highlight the multi-sectoral response and accountability. In special setting, mainly the high burden setting, strong national coordination mechanism where the very highest level need to be involved, which we heard from our Indonesian colleagues. And we also need to take in other contexts the opportunity of existing overarching mechanisms, such as the SDG monitoring body, such as the country coordination mechanism, and those. Obviously, other existing platform like the private public mix model also very, very important. We need to remind ourselves about the TB SDG framework, which is a very strong monitoring document, and to define the role of different sectors and set a monitoring indicator. Unless we define the role of different sectors, the commitment will not be in action. Now, our region would like to lead by examples. So we would like to just briefly show you the 3 examples. One is the Vietnam, who established a high-level commission for tuberculosis, which is led by Honorable Deputy Prime Minister. Second example is Philippines, and that's quite an evolution. Philippines started the multi-sectoral response as early as 2003. However, that needs some maturation. And by 2016, they put it as an act or law. And by 2019, they set up a national coordination mechanism, and they also set up a regional coordination mechanism. The China, which you are seeing that they are MAF checklist, also established interministerial coordinating body and system for prevention and control various communicable diseases at the state level, which includes tuberculosis. So to summarize, our regional vision to be an intersectoral champion and play the same role from WHO, which we urge ministers of health to do. So we ask them to do multi-sectoral response. We ourselves as a WHO need to or will be a multi-sectoral player with all other United Nations agencies and partners. Our regional framework will highlight the multi-sectoral response. Regional Partner Forum is led by regional director. And in this regional partner forum, there are all UN agencies, but also other key players like the Asian Development Bank and World Bank. We also coordinate and communicate through the existing effort like the ASEAN and APEC platform. And we are embarking the country level assessment in 2021 and planning the specific technical assistance in this regard. But before ending, I think that this is a new area where probably our own staff need to strengthen their skill. So we will be also focusing those who will provide the support to develop the skill of multi-sectoral collaboration. With thanks to all National Tuberculosis Control Program of all member states, I would like to thank you everybody, and back to you, Marcia.
Thank you very much, Tawhid. We continue in our regional perspective, in our regional journey, but now we move geographically and we go to the African region with our next panelist. I would like to invite Dr. Sheila Shawa Musonda, Senior Project Officer on TB of the African Union. Hi, good day. The African Union was a pioneer in setting up a continental accountability framework and a scorecard system to monitor its implementation toward ending TB. What is your experience with engaging high-level political leadership, and how is the scorecard contributing to this process? Also, what result can you show from the scorecard, and how are you monitoring those results? The floor is yours.
Thank you very much, and good afternoon, everyone. So by virtue of being at the African Union, our work involves mainly high-level advocacy with the political leaders, the heads of state, the ministers, senior government officials, and the experts. So in a nutshell, we serve as the interface with all the groups I've mentioned above. And in terms of TB, so there has been a lot of advocacy, starting, I think, from the Abuja 2001. Some of you are quite aware of it. But I think, and we've had a lot of other commitments that have been made since then, and these are highlighted in our accountability scorecard. But I think there was a move in 2015 when we developed the catalytic framework to end HIV, TB, and malaria, which called for intensive efforts to address the three diseases, and it also proposed a business model. So the catalytic framework is basically aligned to the African Health Strategy, which is our overarching document on health on the continent, and this also fits into our Agenda 2063 aspirations. And for those who are interested, I think the Agenda 2063, which is like our guidance document in all our initiative on the continent, is available online, so you may want to look through it. So in July 2018, after a lot of advocacy, with the assistance of WHO, the technical support from WHO, we developed our scorecard on TB. And this was also in line with the other various scorecards that we have. And the scorecard was adopted by the heads of states in Nouakchott in Mauritius during the July summit. So the scorecard is produced as an accountability tool, which we actually update yearly, and we present it to the heads of state during the summit. And also we have the experts review it in during our meeting, which we hold every year. We've also been supported from last year by the Stop TB Partnership in developing the scorecard. So we have our 2020 scorecard, which is actually in its draft form, and we're yet to share it with the countries for verification before we produce it. And so because it's a new document, we've been doing a lot of revisions. So the 2018 scorecard is a bit more technical, speaks more to the experts in the countries. But then we realized that the senior government officials do not understand our science so well. So we've been trying to adopt it so that it speaks both to the experts in the countries, but it also gives our senior government officials, the heads of states and the ministers, just a glimpse, a snapshot of what is happening in countries in terms of TB response. So for the 2019, we also decided to capture, at least include 2 targets under the UNHLM, and then we also included a column for capturing data on catastrophic cost and also the domestic financing allocation to health by each country. So like I said, it's a snapshot and we produce it every year and to the heads of state, but we also produce it during our specialized technical committees for health, where we actually have our ministers of health gather and review our document. So in terms of the results that we can show from the scorecard and how we are able to do monitoring. So because we have more than 10 indicators, I'll not go into details on that, but I can share at least 2 or 3 outcomes that have been significant. And hopefully we'll have the scorecard ready on time, which we can post online and it can be accessed for everybody. So from 2018, the scorecard showed that most of our countries were in red. I mean, it was just showing that we're not really on track in attaining the Stop TB target. 2019 saw a lot of improvement in some areas, not all, but at least this is showing that there's progress. So the 2020 scorecard, I think I'll just pick on one indicator on the reduction in mortality. So what we have now in the draft form, it has shown that there's a 19% reduction in mortality in about 9 countries. And this is in comparison to the targeted 35%, for the NTB targets. So we have 9 countries that have actually, shown a lot of progress in reducing the mortality as a result of TB. And these, I think, include Eswatini, Kenya, Malawi, Mozambique, Sierra Leone, South Sudan, Togo, and Tunisia. And comparing with the 2018 targets and 2019 targets on the catastrophic cost, when we started in 2019, one of the things that we noticed was that there was very limited data on catastrophic cost. So our scorecard appeared mainly, I think it was mainly gray, except for 1 or 2 countries that had some information, but most of the information was really not sufficient. It was limited. But as of 2020 now, we have at least 4 countries that have been able to collect sufficient information on catastrophic costs in relation to TB services. And these are Kenya, Ghana, Nigeria, and Uganda. And also we were, because we have now moving to advocating for increased financing, domestic financing to health for all our member states. And we've had the ALM declaration, which is actually calling upon countries, private institutions in countries, and also even including philanthropists to actually support health initiatives in countries. So we wanted to also measure how countries were faring in terms of financing their own TB programs. We know that some programs are more well-financed, and there's actually information on that, but we had very little information on TB. So when we started in 2018, we have very limited information, but by 2019, countries were able to capture at least how much they are financing the TB programs. So as of 2020, our draft shows that 2 out of the 55 countries have reached at least 75% in terms of financing their TB programs. And these are Angola and South Africa. And we have countries, 5 countries that have actually reached in between the 50 to 75% financing gap for TB, financing resources for TB. And these Botswana, Cape Verde, Gabon, Lesotho, and Morocco. The rest of the countries are still heavily dependent on external funding, but I think this also shows that it's a great improvement, considering that in 2018 we had no data, but now we have, and we think that at least in these 7 countries are a model for the other countries to see that, well, they are able to support their own programs, and so they can also start increasing their financing towards the TB programs in country. And in terms of monitoring, the scorecard is accompanied by the Africa Continental TB Accountability Framework for Action. And this was adopted from the Multisectorial Accountability Framework, which is a global document, but suited for our context. And the framework highlights the major commitment that we have done as a continent towards addressing TB, and also it highlights some of the major actions that countries should undertake to reach the NTB target. And it also provides guidance on the performance review processes, including reporting mechanisms where it calls for reporting countries to report to the ministers of health during the STC and then during the WHO meetings, and then to the heads of state yearly during the summit, and to the other relevant governing bodies, including the AU bi-yearly and I think quarterly when we have our meetings. So I think with that, I think that's some of the key elements I can share on the scorecard and the accountability framework. Of course, when you do have the document ready, which is hopefully by the time we have the summit in February, we'll actually have it online, and it will be available for access. Thank you.
Thank you very much. I would like now to move to a slightly different perspective, but we know that achieving global TB target requires urgent multisectoral action to address the broader determinants that influence the TB epidemics. And for that, I would invite Dr. Delia Boccia, Assistant Professor at Faculty of Population Health and Policy on the London School of Hygiene and Tropical Medicine, a co-founder of the Sparks, to answer the following question. What is the role of social protection in driving the TB agenda forward? Dr. Boccia, the floor is yours. Thank you.
Thank you very much, and good afternoon to everyone. Thank you very much for inviting me in this webinar. It sounds like really an exciting opportunity to share with you some concrete perspective on how we can really move forward in this trajectory. So I'm here, as Marcia said, to represent both the London School of Hygiene and Tropical Medicine, but also as a representative of the Sparks Network representative, which is a network, a research network looking at the health impact of social protection. The question that I've been asked to answer, it is ambitious indeed. However, you didn't need to ask me, because I guess that someone a lot more authoritative and a lot more important addressed this question more than 100 years ago. During his Nobel Prize speech, Robert Koch has affirmed very firmly that the management of tuberculosis required the creation and establishment of social welfare centers. And the component of these welfare centers were, for example, community-based approach where people were visited at home, grants in terms of cash that were given to people, food support, fuel support, and also a number of laws and legislation that were able to support these people. To my mind, this description that we're given from a microbiologist, not an advocate, someone that a fanatical of social determinants or structural interventions, but really a biomedical person, was able to see this and had this vision. And to me, his recommendations are very resonant with what we conceive today to be social protection and our contemporary definition. The recommendation of Robert Koch have been largely unheard, at least in our contemporary approach to tuberculosis elimination, despite the fact that social protection now is an established element of the WHO TB elimination strategies. I challenge anyone in this audience to say that social protection is really a core element of TB response in countries. Its role is still rather marginal, and this despite the fact that we have a solid base of evidence that suggests that the potential for social protection to really support TB elimination are quite remarkable. So in this summary slides, you can see that social protection, which usually entails interventions aiming at reducing poverty, to provide labor protection and psychosocial support, they have a demonstrated effect on reducing people vulnerability, psychosocial and biological vulnerability, reducing disease morbidity and mortality. This impact is less obvious or less documented, but increasingly available, and to mitigate the financial and physical and psychological consequences of diseases. How this translates to tuberculosis? Where social protection, there's a growing number of evidence that suggests that social protection has the capacity to reduce the exposure to tuberculosis risk factors by tackling the social determinants that were mentioned by Dr. Kaseva. And it has the potential to allow a more equitable and timely access to quality TB care and to minimize the direct and indirect costs that follows from tuberculosis. This ultimately results in a reduction in diagnostic delays, an increase in treatment uptake and adherence, and improve in treatment outcomes. And overall, this has an effect, once again, in TB prevention, TB care, and TB support. Now, the evidence that we have accumulated so far, they're not enormous, but I think they are sufficient to trust reliably the capacity of social protection to support the TB elimination agenda. I can guarantee, I can tell you that this evidence have been generated over the past decades in a, I would say, not a particularly helpful funding environment, but still, thank you through the strenuous effort of colleagues of mine, and including people at the London School, we were able to create a sufficient, again, base of data that support very strongly the role of social protection in moving the TB agenda forward. Once again, the evidence are not massive in terms of numerosity. We don't have an enormous amount of evidence. And there's still a lot to do for the consolidation of the notion that social protection can have this role. However, it is important to say that for other type of interventions, we didn't need to have the amount of evidence and the amount of confirmation that we require often to socioeconomic and structural type of interventions. To me, the evidence that we have are sufficient. If anything is missing, it's definitely not whether social protection can do something for tuberculosis elimination and to move the agenda forward, but how. And this is something that also Dr. Tanweet also mentioned. The most important persisting knowledge gap to me remain how we ensure a better dialogue and a more efficient integration of TB care and social protection services. That is, how do we ensure that existing social protection schemes are sensitive to the needs of TB patients and inclusive enough to make sure that the vast majority of TB patients is enrolled in these programs? Also, how can we ensure that TB services are innovated and transformed in a way that they become centers and places where the social needs of patients is properly appraised and screened, and patients are referred to the appropriate social protection scheme. These are research implementation schemes that has independent academics and has PARCS members we have tried to address, and we are starting to try to study more in depth. However, I think that the capacity to answer this question is pretty much in the remit of GTB, and especially through the full exploitation of this multifactorial accountability framework. This is a top priority if you want to fully and convincingly respond to the question posed in this webinar. COVID-19 has taught us how incredibly vulnerable we are on this planet, but also how incredibly resilient and incredibly powerful we can be when we want to really harness a change and really accelerate a change in the way we approach a given disease. It has taught us, I should say once again, that social policies are indeed public health policies, some sort of social medicine that allow us to address diseases by preventing the risk factors, by supporting people in navigating the cascade of care, and by mitigating the consequences of diseases. This is the reason why social protection has been such a key element of the response to COVID. If you have seen the two strategies, the biomedical response and the social protection from countries have gone absolutely in parallel, and they have been considered to be absolutely fundamental and integral part of the same response since the very beginning, acknowledging the impoverishing effect and the profound health inequalities that COVID was creating and perpetrating. For tuberculosis, this is far well known, and it should require the same approach and the same acceleration of changes. I want to hope that the purpose of a seminar like this is really to embrace this concept of social policies being health policies, and to translate the vision that underlie the multi-sectoral accountability framework into concrete actions. As discussed in this brief talk, the question is, to me, is not whether social protection can, what social protection can do in moving the TB agenda forward, but how we can harness the evidence generated in the TB field, but also from other diseases. So the answer to me is pretty straightforward. It is positive. It's definitely, there is a large room for social protection to help, but we need to understand better the how. We need to work out how we can really make sure that social protection becomes a resource against tuberculosis. And I know that I started this brief talk with an answer, and I would like to conclude with a question to the audience. It's like, are we really ready for this? Like, I've been working in this field for 10 years, and I can see once again that there is a momentum. Are we really able to capitalize and to really build upon this momentum to really make social protection an element, an integral and concrete element of the response, of our response to tuberculosis? Thank you very much for your attention.
Thank you very much, Delia. That's been very interesting. I now invite our last panelist to take the floor, Dr. Nobu Nishikori, Medical Officer of World Health Organization, Global Tuberculosis Program, leading the work on catastrophic costs due to TB among patients and their families. And I would like to ask for a country example of examples of multi-sectoral action with a perspective on catastrophic costs. Dr. Nobu, the floor is yours. Thank you.
Thank you very much. Thank you, Marcia. Hi, everybody. Good morning, good afternoon, good evening. I'm Nobu Nishikori, working for Global TB Program. I'm just given the task to elaborate some of the country examples, but I think I'm not in a position to do that. I think ideally speaking, we would have a lot of different countries to present their experiences. But for the sake of time and this limitation of this webinar setup, I'm going to try to summarize some of the important development we see in the field. So because it's relevance to the TB patient cost survey, which I mentioned several times in the previous talks, I'm going to start with that. So findings from the TB patient cost survey in the last 5 years of implementation. So overall, TB affected families faced a large financial burden, about 94% catastrophic cost due to TB. Substantial portion of the costs are non-medical and the indirect cost, lost income. So you can see that the direct medical costs are quite small proportion. Although NTP has more to do to eliminate this medical cost. But if you're ready to eliminate the catastrophic cost due to TB, as in the NTB strategy target, we really need to work on how we can improve social protection or support for the TB patient to eliminate these non-medical indirect costs. And also not only this catastrophic cost indicator, we see a lot of different great important information in terms of the TB patients and families lost their jobs, children disrupted schooling, took loan and they sold asset, and then they are pushed deeper into the poverty. So we are seeing this devastating impact of the TB on the livelihood of the patients. Therefore, we really need to this is another reason that not only the epidemiological or the ending TB itself, but also we want to have a broader coalition against the social sector players to mitigate the suffering of the patient. So that's another way to see how the multi-sectoral response is important, critical for the patient lives. So due to this reason, after the patient cost survey completed, many countries went into the different types of the policy translation with the multi-sectoral partners. So there are a series of the different examples, but I don't probably have time to explain each country's experience separately. But rather, I would like to try to see some summary for this specific webinar today. But overall, this example of the national actions, we see that these discussions and policy dialogues are connecting to the eventual establishment or discussion on the establishing the Maf-Tb implementation. So that's really is great to see that this survey becoming the entry point for discussion of the policy, multi-sectoral policy dialogue. I I don't have enough time, but probably I see this way of summarizing multisectoral actions. We have a lot of different multisectoral partners to collaborate with, but each sector has quite a different way to contribute. And if I look at these different policy translation examples, we could summarize each sectoral actions into the two categories. The first set of action is multi-sectoral partners can provide services or link with the TB services so that they can target on the specific vulnerable or key populations, and then providing the quality TB services in collaboration or in its own, provide the TB services. That's the first part. The second part is some sectoral policies is really important to improve the TB program objectives. For example, social welfare sector have social protection schemes that is really needed for some of the TB patients, but also labor sector policies are so critical for many aspects. So if I look at this way of looking at the different actions, we could summarize some of the sectoral actions in these two ways. So, for example, the social welfare, social protection sector, this is, of course, a key sectoral partner to address the catastrophic cost, and also how it is important was elaborated by the previous speaker earlier. And also, it's important to link with the poverty reduction strategy. So it is a central part of the SDG 1, right? Then in this sector, TB service specific, this specific sector might have a very good, the connection with the most vulnerable populations in the country, so that they have opportunity to provide services, TB-related services to this specific population. But also this, as I say, sectoral policy-wise, the social protection schemes are so critical for support TB program objectives. So there are several examples of this, like cash transfer program, disability grants, or social security programs. These are also linked with the TB program in different ways. And then also another example, for example, labor sector. So labor sector has a wide range of the policy instruments, including labor code, occupational services, occupational health services, occupational safety policy, and occupational disease policy. So all of this differently connecting with the TB related agenda. And then, of course, employment is the key to sustain livelihood of the many TB affected families, because many patients have a problem of the employment during the TB episode. So this labor sector intervention may include health checkup on employment or a regular basis, which is also actually great venue for the TB screening services, and also workplace TB services for provide treatment and care at the workplace, so that the patient can do not lose the time during the treatment and continue to be productive. And the sectoral policies include labor law, protect employment, or workplace policies for disease conditions or health conditions. So this is already, there are a lot of precedent with HIV. So we could ride on this HIV workplace policies to be expanded to TB as well. And also, as I said, occupational safety, occupational diseases. So these are another areas we can explore more. So I probably don't go into all the slides now, because for the sake of time. And then just want to mention that, each of these sectoral action can be formulated by probably bilateral dialogue, but they also should be the way to overarching multi-sectoral actions to accommodate under the national framework to NTB. So there are different examples for this, and we really hope this from now on, like Uganda already shows a case that this type of dialogue lead into the establishment of the Maf-Tb, and which include a large number of the sectoral partners to work on together to formulate the national response to TB. Over. Thank you very much.
Thank you very much, Nobu. And thank you to all the panelists and the speakers for this wide range of experiences and perspectives. I now invite you to turn on your videos and while we move to the Q&A session. I know we are running a little bit behind schedule, but I hope that all the attendees can stay with us a little bit longer. So to kick the Q&A, I would like to open the box, the Q&A box, and maybe start with the question posed by Bertrand Compère, asking how the checklist the Maf-Tb checklist can be useful and used for conducting baseline assessments. And maybe it would be good to hear from a country perspective. So either Dr. Patrick from Uganda or Dr. Imran, if you want to start answering this question, and then other panelists are welcome to answer as well.
Yeah, maybe I can answer for this one, Marcia.
Sure, go ahead, thank you.
So Bertrand, I think this checklist is very useful also as a guidance for country to assess how the condition of multi-sector role in TB elimination. And I think if we look for the tools, so it is a very simple one to know about how the multi-sectoral approach framework should done in the country. Because it may be, you know, the document is already there also, but it is the easiest way to advocate to the other sectors of how they can contribute to the TB elimination. And I think also we can adapt the checklist for the national level to monitor how the framework done in the national level. So I think that's my opinion, Marcia, about the Bertrand questions. Thank you.
Thank you, Pak Imran. I don't know if any other panelists would like to add on Pak Imran's contribution. Okay, so we have another question.
Marcia, sorry.
Yes, Julia.
Can I add to this contribution?
Sure,
by Imran
please.
as well? Yeah. Hello, Bertrand. I would like to add here that I think it's very important because the checklist gives a baseline and it helps to identify needs and gaps and through different perspectives. And then based on this, one can proceed with building issue-based multi-sectoral plans. And if to implement this checklist and baseline after a certain period of time, it will give a dynamic of change and it will be possible to measure what is there. But I would also like to raise attention that there are practical needs in order to implement these checklists, and they come to resources for the assessment teams to do it at the country level. They come to the agreed process of endorsement of fundings and having like specific TORs for the experts involved in different assessments. So it depends basically, a lot of it could be resolved based on technical collaboration with WHO offices, regional offices, as an example in Europe, but yeah, that's my 5 cents to that.
Thank you very much, Julia. Actually, don't mute yourself because I have another question to you. And it's about the country, at country level, what priority activities should civil society engage in?
I think in relation to MAF, to multi-sectoral accountability, as 2023 timeframe for head of states to report on the UN high-level meeting on the progress achieved, it really brings entry point and the window of opportunity for priority actions to CSO, to create an enabling environment to start the assessments and to accelerate the multi-sectoral processes. And specifically what could civil society and community organizations do is that to have a consolidated messaging through its own forums or equivalent in the country levels and reaching to high-level decision makers, elevating the discussions on multi-sectoral accountability, the country coordinating mechanisms on HIV, AIDS, and TB, and also presenting there the united voice in this country level, national level country coordinating mechanism discussions. And also to support implementation of Maf-Tb processes with other national processes, such as development of TB national strategic plans, annual TB progress report, and also bringing Maf-Tb under the agenda of funding requests development for ensuring funds for community and civil society system strengthening and Maf-Tb capacity building, implementation and operationalizations. Because in order to have sustainable resources are needed to be invested in TB and to be invested in Maf. Unfortunately, till now, even with the global funds, there is still a disease split, and TB doesn't have the share it deserves. And I'm very hopeful that it will be readdressed in the new global fund strategy. Thank you.
Thank you. If the other panelists want to contribute, just go ahead. Okay, then I have another question. Actually, Gerard Vry has another question. Is asking if presenters can reflect on meaningful introduction of Maf-Tb, WHO Maf-Tb, in low-burden countries where TB notification rates are below 10 or 5 per 100,000. I see that Teresa wants to answer. So Teresa, please, the floor is yours.
Yes, a very good question. And I would like to refer you once again to our global TB report of this year. So we've requested countries to respond to the questions about MAF implementation, and we've received responses from 215 countries. And you know that we have 30 highest TB burden countries. And it shows clearly that countries, including low burden countries, are already working and interested and I hope found it useful instrument, because definitely not only high TB burden countries can benefit from it. Indeed, in fact, in the low burden countries, it could be really clear example, taking into low hanging fruit, taking into consideration the low burden and the limited number of patients with TB. You can show very quickly how this instrument of multi-sectoral engagement can work in practice. And this example then can be shared because it's for TB, but not exceptionally. It can be used also for any other diseases. So that's why I see a direct benefit and can see that it works and is uptaken also in low burden countries.
Thank you, Teresa. Any other comments? Otherwise, I think that in the interest of time, that is all for our Q&A. But I do invite you all to reach out by email with further questions. We will be happy to come back to you and respond, and our fellow panelists as well. Before closing, I invite you to take your phones, and okay, I hope you can see my screen. Yes, with your phone, open your camera and scan the code that you see in the middle of the slide. You should be redirected automatically to this page. So in case you are or you already have an account on then you can directly log in or join as a member. So we also put the link in the chat. So if you don't want or you have issues in scanning the QR code, it's also possible just to click on the link that you'll find in the chat. And that will bring you through this page. I'm going to show you what happened when I clicked on that. You should be able to see the WHO Maf-Tb forum page that we want to inaugurate today. So this is really a tool to continue being in touch and sharing live feeds, and you can find media center and the new with all the documents related to WHO Maf-Tb that you can easily click and read, as well as an events one where our MAF webinar was a live stream, and a section with Q&A with all the burning question on Maf-Tb. So please join us in this forum. And I think that with that, I thank you all, and I give the floor back to Teresa. Thank you.
Yes, thank you very much, Marta. I see participants are asking to share once again link QR code. I expect there will be a lot of people, hopefully crowdy and very intense discussions. So we decided that it's very important at the end of this year to have this webinar and to present to your attention some information about the progress, our plans, what is happening at different levels, global, regional, and country level, what are the issues, gaps, and where we should move to all together. Definitely, no doubt, and we could hear from all our excellent panelists. Special thanks to you for your time and your work. There is no double opinions that there is another way if we would like really to be successful and to reach targets, neither a multi-sectoral engagement and broad range of activities. Of course, we are traditionally focusing on people suffering, to find them, to diagnose them, to treat them, and we should definitely continue. But we should go beyond, because TB is a clear example of the disease, so-called social depending disease. And this vision of multi-sectoral engagement is not new, as Tohito. It was not even Delia demonstrated. It existed for many years, but somehow we didn't take it seriously enough. But now the intention of all this movement is really to shift to this approach, to change mindset. It's not easy, but until we will not understand that combating TB should start beyond health sector with engagement of other social determinants, we will not succeed. So, but I'm personally very positive, very optimistic, because I see huge and growing interest and see the intentions really to shift, to move this direction, and we will continue working closely with you. You will find all the information, news about our plans for the next year in this page, and we will share through different other sources, via news flashes. We are planning to have these webinars on regular basis, so don't be upset if you didn't manage to ask your question. So there will be many opportunities. We're also planning actively collect best practices, country examples, which are extremely useful for you, which can also help to respond to your questions. And of course, we will continue working on different tools, guidance, which can help you in adaptation and implementation of MAF vision. So thank you very much once again. It was a difficult year for all of us, but we hope that we will manage, we will overcome all the problems. And I wish you, your families, your colleagues, to all of you the very best on behalf of the WHO Global TB Program, all regional and country offices. Please take care, stay safe and healthy. All the best to you. Thank you.